Missouri Attorney General Andrew Bailey is releasing details about an emergency rule today that he will be filing to make it harder for transgender children to access gender-affirming care. AG Bailey told our Missouri Chief Capitol Bureau reporter Emily Manley he's creating the rule to protect kids.
And so it was necessary for us to use our emergency rulemaking authority to put some safeguards in place and hold these providers accountable and make sure there's real informed parental consent.
Restrictions are soon coming to physicians who prescribe hormone treatments and puberty blockers.
We had to take steps now to ensure there were safeguards in place, given the amount of evidence that we found in the course of our investigation and the fact that these clandestine, shadowy pediatric transgender care clinics are all over the state of Missouri.
In less than 2 weeks, Attorney General Andrew Bailey will file a rule prohibiting experimental interventions to treat gender dysphoria unless providers comply with a list of requirements.
Doctors that are going to go down this road need to obtain legitimate and legal parental consent. The parents need to understand the experimental nature of the drugs and the dangerous consequences of irreversible surgery.
Under the regulation, anyone receiving puberty blockers, hormone treatments, or gender transition surgery must first receive 15 hourly sessions with a mental health professional over at least 18 months.
These are mental health patients that are coming in with mental health issues. Why aren't we treating them like other mental health cases using psychology and psychiatry?
Bailey says this rule comes after a whistleblower who previously worked at the Washington University Pediatric Transgender Center at St. Louis Children's Hospital claimed the program was harming teens.
The bravery of the whistleblower coming forward and alerting us to the fact that if even 1/10 of what the whistleblower is saying is true, these are serious allegations and children are being harmed.
The Attorney General doesn't get to legislate. These doctors are already doing exactly what they're supposed to be doing.
The details of Bailey's rule come on the same day the House passed legislation to ban gender-affirming care for minors.
I don't know how I can call somebody a friend who is actively hurting children.
The emergency rule is set to expire next February, but Bailey says it can be extended if a bill doesn't make it to the governor's desk.
This is the maximum extent of the safety measures that the Attorney General's office can put in place today to stand in the gap until such time as the General Assembly can enact their bill.
Reporting from Missouri Capitol Bureau, I'm Emily Manley.
LGBTQ organization Promo Missouri issued a statement in response to Bailey's new rule, saying in part, the Attorney General's claims are maliciously cherry-picked and come from unverified sources. It should be clear to anyone paying attention that the real threat to Missourians is the Attorney General himself. In our next half hour, Missouri Chief Capitol Bureau reporter Emily Manley will join us live, and she will explain more on the effects of this emergency rule along with the House bill that passed on gender-affirming care today.